Hi everyone, Dr. Lisa Vuich here. Thank you so much for joining me for this video where I'll be talking about our medically supervised weight loss program at Renew MediSpa. So this is a medically supervised weight loss program which can enable you to end yo-yo dieting, achieve your goal weight, improve your metabolism without any sort of speed type medication. And really this can be your route to a long-term solution to trouble with weight loss. We're going to go briefly through the fact that weight loss is really an epidemic in our country. So if you've got 20, 40, 60, 80 pounds to lose, you're certainly not alone. But fortunately, we've got some game changers in medically supervised weight loss programs. And I'm going to talk about basically where this medication came from, how it works, and how you can access it. You'll learn more, of course, how to take action on this program if you're interested, and I'll review some frequently asked questions. So overweight and obesity, as you probably know, increases the risk of many other health issues such as type 2 diabetes, high blood pressure, heart disease, stroke, joint problems, liver disease, and the list goes on. These are called weight-related illnesses, meaning they can be brought on or made worse by being overweight. And what often happens to these individuals who are affected by this is they end up on polypharmacy, which is a medical term for multiple medications, sometimes 5 or more. I take this for my reflux, and this for my high blood pressure, and this for my blood sugar, and this for my cholesterol. And before you know it, you've got the pill bottles lined up. And of course, there are psychological consequences to carrying more weight than you're comfortable with. I don't need to tell you about those. And clearly, people even get discriminated against in the workplace when they're overweight. The trend has been going up over the years and is especially difficult for our children. And I can certainly tell you it didn't get any better during COVID. In fact, I, like perhaps you, gained COVID-19 plus some before I finally came across this medication, had success with it, and decided to share it with our clients here at Renew. What you may not know is that overweight and obesity also raise the risk of many forms of cancer, and those are listed here in this cartoon here. So I want you to start to think about achieving a healthier weight actually as a form of preventative medicine and as a form of actually reducing your risk of cancer as well. And in addition, of course, you will improve your quality of life, feel more comfortable in your own skin, feel more in control of your life. All sorts of good things happen when we're able to move the needle in the right direction. Now, in the past in medicine, we haven't always done so well with assisting people with this significant problem. These sort of MediFast programs where people just drink shakes and take a bunch of supplements, tend to produce very short-term and modest results. For many years, phentermine has been prescribed. Phentermine is really a stimulant that artificially raises your metabolism. It causes lots of side effects. Your body gets used to being on it fairly quickly so that it stops working for you. And then when you come off it, you just gain the weight back pretty predictably. So that's certainly not an ideal option. And then HCG diet has also been a craze. It's actually frowned upon by the FDA. It doesn't, they say it doesn't work. I say it doesn't work very well. Certainly doesn't work consistently. So where did we go from there? Well, here's the issue, and here's where we need to attack the problem from. There's a phenomenon called insulin resistance, and this is something, you can be insulin resistant if you have the genetics for diabetes, for example, and that's because, your pancreas doesn't work the way that it should, and that's genetics. But you can also be insulin resistant if you're overweight. And it gets to be a vicious cycle because when you're insulin resistant, you tend to feel more tired and more hungry more of the time. So you tend to eat more food, tend to make more insulin, your cells get more resistant to insulin, and you store sugars and other things that you eat, carbs, as fat. And then you get more insulin resistant and the wheel goes round and round. So the more weight you gain, the more insulin resistant you become and the harder it gets to lose the weight. So it's very, very difficult up until now to actually break that cycle. So what if you could break the cycle? What does that mean? Well, that's what we're going to talk about. Semaglutide has honestly been a game changer in the weight loss field. Now, you may have seen commercials for Ozempic or Wegovy. Ozempic and Wegovy are semaglutide. They are packaged and made by Big Pharma, of course. Wegovy is simply Ozempic with a different label on it and marketed specifically for weight loss, whereas Ozempic is marketed more for diabetes. So we have these tools available that provide us with actually a more sensible option also for weight loss. And the reason that happens is because we're able to manipulate a hormone in the body called GLP-1 by adding semaglutide. And the semaglutide, as I'll show you, looks to the body like GLP-1. And that makes it a lot easier to lose weight. So GLP-1 is really your friend if you want to lose weight. GLP-1 is something that's naturally occurring. It's secreted in our gut and targets receptors, as you can see here, throughout our body. So GLP-1, if you want to lose weight, is really your friend. Now, fortunately, it is something secreted in our gut, and it targets multiple receptors throughout our body. In the stomach, it delays the emptying of the stomach, so you feel fuller quicker. It also slows down the intestinal motility in the small intestine. So basically, your GI system slows down a little bit, and you feel full. In your brain, it increases satiety, which means your brain thinks you're full. Your appetite reduces. In the kidneys, it basically increases diuresis, or the movement of water through the body. In skeletal muscle, it increases glucose uptake. In the liver, it decreases sugar production that happens normally from the liver. And it also helps your insulin production. And it increases sugar uptake by the adipose tissues and increases the breakdown of fat cells. That's called lipolysis. You see there, increased lipolysis. So the fat cells break down more easily when GLP-1 is around, and GLP-1 overall makes us more insulin sensitive. Well, semaglutide, as I'll show you, looks to the body very much like your native GLP-1. So what semaglutide is a peptide. Now, peptides are chains of amino acids, proteins that we eat, like steak for dinner. Protein is a longer chain of amino acids, okay? So peptides, think of them like smaller proteins. Semaglutide varies from our own GLP-1 only by 2 amino acids in that chain. So as far as your body is concerned, semaglutide looks like GLP-1. And that's very, very useful, as it should be obvious by now, if we want to mobilize that stubborn fat and lose weight. Now, in some of the pivotal studies, in the obesity trials with the medication, about 16.2%, I'd say, would be the weight reduction on average. So, for example, if you started out at a weight of 200 pounds, a 16.2% reduction would be a weight loss of 32.4 pounds. So what's the problem? Why isn't everyone on Wegovy? Well, there's a few issues. First of all, the out-of-pocket cost for the prescription pre-filled pen, injection pen, is $1,400 for a month's supply, roughly. There have been additional issues with Wegovy being on back order. They're, for whatever reason, not able to make enough of it. So it can be very difficult to get most of the doses of Wegovy. So there's a problem with the supply chain, and that's been going on for months, and it's still going on at this time. March 2023 is when I'm recording this. An even bigger problem is if let's say Wegovy is available, it may not be covered by your insurance. So you may have to eat that out-of-pocket cost. And you might say, well, why wouldn't they cover it? It's so amazing. Well, that's a bigger question than we have time for. It may not be on the formulary at all, or they may set certain criteria. They may say, well, you have to be a certain weight, or you have to be morbidly obese and have 3 medical diagnoses, or whatever, essentially whatever terms, whatever conditions the insurance company wants to set in order to regulate coverage, they're going to set them, and you may not meet them. So that's another problem with access to the prescription brand. Now, fortunately, we're able to get semaglutide from what's called a compounding pharmacy. Okay, compounding pharmacies are all over the United States, and they mix and combine ingredients to make what are called customized medications. One of the compounding pharmacies we use is Wells Pharmacy, and they compound the semaglutide with something called BPC 157. Now, that's just another peptide that's been studied quite a bit, as you can see in that sort of screenshot, National Library of Medicine. Lots of studies on BPC 157 and how we might use it. It's actually a naturally occurring peptide that was discovered. It's in, normally in human gastric juices, and it was discovered when they were looking for a cure for Crohn's disease. So this peptide is put in with the semaglutide because it helps to offset some of the side effects that we can see, that we'll talk about, that can sometimes happen, especially when you're starting the semaglutide initially. So it helps soothe the stomach. potential beneficial effects, anti-inflammatory, wound healing. It's got other beneficial effects that we don't really need for the semaglutide program. But just so you know, when you see the vial and you see BPC 157, it's just something there that's combined with the semaglutide to reduce side effects. Now, the most common side effects of starting semaglutide are listed on the left here. Number one is a queasy feeling, nausea, not generally to the point of actually vomiting, but just having that sort of upset stomach feeling. And that's pretty much the number one thing people will report to us in the beginning. By the time they've gradually increased the dose, which we'll talk about, it goes away. But in the beginning, it can be an issue. So for this reason, we gradually titrate the dose up over the course of weeks, as I'll show you, and that mitigates that and makes it very manageable. The other potential side effects, I have to say, we really don't hear much of any of those, I guess, although they're potentially side effects that you might encounter. So to reduce the incidence of the side effects, what we do is we titrate the dose, okay? We increase it gradually. So you'll start at a low dose and you'll gradually increase your weekly dose over the course of 3 to 4 months, usually 3 months. And this is a once-a-week self-injection. If you were experiencing significant nausea, you simply wouldn't take the next dose increase step. You would wait for that to settle down before you increased your dose. And I would say also, if you are experiencing that nausea or upset stomach at any dose, you want to take a step back and think, all right, what did I eat right before that came on? Because it might have been an issue with the portion size you tried to consume, or high-fat foods also are more likely to trigger that queasy feeling. So simple dietary adjustments can mitigate this as well. Now, here's 2 example dosing schedules. Now, if you're using the brand name Wegovy, you would be increasing your dose only once a month. So in weeks 1 through 4, you'd be at the lowest dose of 0.25, and every 4 weeks, you would gradually step it up until you got to the ultimate dose of 2.4 milligrams, which is 0.9 mLs, and it would take you about 17 weeks to do that. Fortunately, with semaglutide in the vial form, we can actually micromanage this a little better, a little easier, and get you up to speed more quickly as long as your stomach is doing well with it. So in the blue table, you see what we generally are doing with dosing, which is we're going up for most people every 2 weeks by 0.1 mLs. So I'm going to show you essentially how to do the injection. So your vial will come in the mail in a prescription bottle. So you'll open that up and it will look like this. You see it has that BPC 157 name and semaglutide. It's got this red cap on it, and it's very important. You have to take that off. I've got nails, so it's not going to be that easy for me to do that. Okay, I got it off. So red cap off. Now you can see there's the rubber stopper where the needle goes through. So the needles are the tiny Botox needles. Probably doesn't look too tiny up in the camera, but it actually is quite small. You have to take that end off, and you have to take the end off. And now we've got our needle. So what you can do next is take an alcohol wipe, and you can wipe the top. Now it's very important that you invert the vial, stick the needle into the plastic, and then you draw back. All right, and you got to look and see if you're getting an air bubble, push that back. But you're basically going to draw up to whatever dose you on. So if you're on 0.2, you're going to draw to the 20 on this. Sorry, I'm going to kind of show that to you. It says 20. That's 0.2. Okay. And you take that out, and now you're ready to go. I'm going to put the medication back in the vial because I'm not due for a dose. But I'm still going to show you how to do it. So we're going to go back to 0.2 with no medication. So what you do, let's see if I can show you this here, is you simply pinch a little part of your abdomen right there. That's where you're going to put it. You wipe with alcohol. You can pinch that, the needle in, plunger, done. And you can see it's so tiny, there's not even a blood spot. And I honestly did not feel that. All right. So it's as simple as possible. We will, however, have you do it at your intake appointment You'll drop the medication, you'll give it to yourself in the abdomen. We have had a few people who were so nervous about it that in the beginning, they got their vial, they brought it to Renew at a scheduled appointment, and the assistant did it for them. That's not a problem. We're happy to do that for you if you prefer. But I can tell you that the people who did that, by week 3, they were like, I got this. I don't need to come all the way down to you for this. I'm doing it myself at home. So what does this weight management program look like? Well, of course, we need to manage the prescription for you. We'll talk about that. We need to do some progress checks, a couple per month usually, to keep you on track. And you also have the option of participating in health coaching, which I'll explain. So medication monitoring and, of course, the right mindset. You do still have to watch your calorie intake, participate in a sensible exercise program. This medication is really meant to help someone who really has all of that in place to get over the hump of not seeing the results they want. If you don't already have all that in place, then I would definitely encourage you to participate in the option that includes the online health coaching. So what is included in our Lose It Right program? Well, number 1, you need medical clearance to participate. And of course, we provide that for you by reviewing your family history, contraindications, making sure you're set up for success. Regardless of which option you choose, you're getting your first vial of semaglutide, which will last 2 to 3 months. Now, if you use that accelerated dosing schedule, that quicker dose escalation, then the first vial, which is 2 milliliters, will last for 2 months. If you go more slowly, your vial will last longer. Self-injection supplies, of course, the needles, alcohol wipes you can get on your own from the pharmacy, and of course, subsequent prescription vials are not included in your initial startup. People ask about how long am I going to be on the medication? Well, it's going to take you 2 to 3 months, to get up to speed or to get to the dose, let's say, that you want to get to. Now, I want to pause here and say, it doesn't take that long to start losing weight, okay? You will start losing weight within the first 2 weeks. We've seen that pretty much across the board for our clients. It's just that as you get higher up on the dose, you'll likely see it come off quicker. Okay, so I wanted to make that point. So 2 to 3 months of that startup where you're still losing weight, it'll take you X number of months to get to your goal. And then I'm generally recommending that people sort of hit a maintenance point. Just maybe consider being on the medication for an additional 3 months, perhaps dosing less frequently, maybe skipping weeks, maybe going longer in between doses, really just letting your body stay at that set point before you stop entirely. However, one feature of semaglutide is that you can stop it cold turkey at any time without any withdrawal effects, without any rebound weight gain expected, as long as nothing else has changed about your diet and exercise program. So again, it's not habit forming. Your body doesn't get used to it. This is the first thing I've ever used for weight loss that has afforded me that luxury or that experience of being able to stop the weight loss aid and not regain the weight. So to me, that's very exciting. We at Renew here are not going to tell you, eat these foods, have this many calories, choose this diet, this is your exercise plan. You need to come up with that on your own, or if you're doing the health coaching option, you can come up with that with your coach. There are lots of web resources, obviously, out there to help you keep track. I happen to like the Fitbit watches and the Fitbit program. If you're looking to track calories, not everyone with semaglutide needs to be counting their calories. I think that's going to be just sort of a personal decision for you. Really depends on, your general, savvy with nutrition and with what an appropriate number of calories looks like. There are calorie calculators. I show you one here from the Mayo Clinic where you can put in your age, your height, your weight, your sex, and it will tell you how many calories someone at that weight would need to consume in order to maintain their weight. If you take that number and you subtract 500, then that gives you the number of calories that you should be eating in a day in order to lose weight. What if you're going out of town? Another frequently asked question. Well, the half-life of semaglutide is about 7 days. That's why it's a once-a-week injection. So even though half of the medication is out of your system, half of the medication is still in your system. So it's not all gone. You absolutely can push your date out. If you're used to dosing it on Mondays, you can push it out to Tuesday, Wednesday, Thursday, Friday. You can skip an entire week. You can skip 10 days, as I mentioned earlier. So you definitely have that option if you're going on vacation to just go off it and go back on it when you return. Alternatively, if you don't want to do that, you could draw up a dose and take it with you on vacation and just dose it on the appropriate day, leaving your vial at home safe in the fridge so that you don't lose it. So that's an option. Insurance coverage is not something we can explore for you here at Renew. We don't bill insurance. We can't answer questions, of course, specific to your insurance. We cannot fill out prior authorization forms. We're not providers for any of your insurance companies, so we cannot do that. We have been able to take flex spending accounts and health savings accounts cards. Those generally run through without a problem, so that is an option to explore. And we can, of course, provide documentation you may need to submit to that FSA or HSA if they should ask for documentation of what those funds were used for. Now, these are general policies, should be self-evident, but we can't make a specific guarantee as to exactly how much you're going to lose, exactly how quick it's going to come off. That's going to depend on multiple factors, not just the semaglutide, right? Any weight loss program requires your commitment to eating the right number of calories and having a sensible exercise program. We don't issue refunds. We can't take returns of medication. The medication is actually not coming from us, of course. The medication is mailed directly to your home, and it comes from the compounding pharmacy. So we are out of the loop. We are collecting the money for the medication. We are paying the compounding pharmacy. But other than that, we're not responsible for getting the medication to you. All questions regarding health coaching, if you're choosing that option, need to be directed to your Healing is Change coach because they are not employed by us. They are a separate entity, and so they manage those questions. Now, you have two program options with the Lose It Right program. As I mentioned, we've partnered with Healing is Change, an excellent health coach group. We have an option where you pay $19.95. And that includes your first vial of the medication, as I mentioned, plus 3 months of online health coaching through Healing is Change. The second option is medication management only. For that, you will pay a $200 one-time startup fee. And after that, you're just purchasing your medication separately. Just purchase a vial as you need it. We put the order in, it's delivered to your home. We certainly teach you how to self-inject the medication. We give you the dosing guidelines. We give you a whole sheet that you track your dose on. We have you come in every 2 weeks, roughly, according to your schedule, and do your weight and body fat percent measurement on our scale. We determine if you're due for a refill, provide you with needles if you need those. So we're basically managing, everything else around that prescription for you. Now, in terms of the cost of a vial, if you're not in the $19.95 program where the first vial is included, your first vial will cost $5.75, and then there's a $25 shipping fee anytime you order a vial. Now, that first vial should last you 2 months if you do the accelerated dosing, the quicker dosing escalation program. Subsequent vials, we're able to get you a larger vial of 4.5 mLs. Those vials are $6.55, and those at the maximum dose of 0.9 mLs, let's say, per week, that vial will last 5 weeks. So if you do the math on that, it's $524 a month, okay, versus $1,400 a month for the Wegovy pens. So it's a significant savings. We encourage you to give us a call or even start a chat through our website if you're interested in more information about the Lose It Right program. Generally, what we do is we simply set a time for you to meet with one of our medical assistants or nurses. They'll get your intake information, go over your history, make sure you're a candidate, do your weight and body fat measurement with our scale. They'll also teach you how to do the injection, and they'll give you your first dose at no additional charge so that you can actually get started and get that week rolling while you're waiting for your prescription to arrive. Thank you so much for your attention.